My name is Casey Smith. I am a community associate at Trusted Health. I am a pediatric ER nurse myself, and I also actually work remote. I am now on the marketing team, so I know that Miss Sadie is actually the expert, but feel free to shoot any questions my way as well. With us here, we have Nicole. She is our head of community, and she also works remote. So you have 3 remote experts here, but we'll definitely let Sadie do most of the talking tonight or today. Here, so we don't have rules for these virtual meetups, but we do have some norms. First one is good vibes, good times. We're here to have a good time, to learn. So just know this is a safe space to ask questions and to engage with us. As most of you are probably already familiar with, you can feel free to use our mute button. We definitely want to hear you when you want to be heard, but if you are not talking or you don't want us to hear your background noise, then please go ahead and put yourself on mute. If you have questions, you can ask us a couple different ways. Probably for this event, I would encourage you to use the Zoom chat. If you look at the bottom of your screen, you'll see a little chat icon. You can click on that and that will open up the chat to the side and you can ask us any questions there. If it's related to Zoom itself or troubleshooting anything to do with Zoom, and Nicole or I can definitely help you out. If it's related to questions for Sadie, you can go ahead and pop those in there as well. I think she has a few different sections which she'll kind of stop and give us time to ask questions, so you can do so then or throughout it, and she can answer some of those questions then. Feedback. So probably as most of you are aware, we're pretty new to doing virtual events, so we would definitely appreciate any feedback that you guys can give us, whether it's throughout the event or after the event. We will be providing a post-event survey, and so we'd appreciate you guys to fill that out. We want to make these really great for you guys, and so any feedback will help us do so. All right, let's go. Let's have a good time. But before we do that, I want to formally introduce Sadie Glisson. She is a registered nurse and founder of The Remote Nurse, and she also works from home as an oncology data abstractor. So let's go ahead and get started, and I'll let her kind of introduce herself a little bit further.
All right.
Stop sharing my screen now.
One more thing too, just to add, sorry, Sadie, this will be recorded and we will be sharing the recording to everybody who RSVP'd early to mid next week after we clean up and trim the recording.
Thanks, Nicole.
Yeah, so hello, my name is Sadie. Again, I am a registered nurse. I work from home. I do oncology data abstraction, and I started trying to look for a remote job a couple of years ago as a nurse, maybe like 3-4 years ago, because my husband was about to join the military, and I knew I was going to be moving every 3 years. He just so happened to get out now, but at that time I was looking at a lifetime of moving every 3 years, and I didn't really want to be jumping around to jobs all the time. So I also was about to have a baby. Well, I wanted to have a baby, and I really honestly wanted to be home with my baby. That was like my long-term career goal. So I just figured like a remote job might be a good way to balance being kind of a stay-at-home mom, but also like bringing in money and like, you know, still using my license that I paid money to get. So a couple, like those things all together kind of made me want to look into remote jobs. I didn't really know what existed. I knew like in my peripheral mind that they existed. But once I started looking online, there were just so many different types of jobs that were out there that I didn't really understand what they were. And then so just, yeah, over time, just searching for all these jobs and looking at all the titles and finding all this information, I finally got a job in oncology data abstraction, mostly because I had experience in oncology. But along the way, I've picked up a lot of information about what kind of jobs are out there and how to find them, because finding them is like really tough. There's not really one good way to find all of them. They all use different keywords. They use different words, even just for nurse, you know, so it's really hard. And then there's multiple job boards. So you're just like spending so much time finding these jobs if you even know what to look for. So basically with all that knowledge, I was just commenting on a bunch of Facebook groups about a year ago and decided to make my own Facebook group and share out some jobs that I found. And then now a year later, we have like 25,000 people looking for these jobs. It's crazy. Just everybody wants to work from home for a variety of reasons. I mean, obviously most nurses are women, and a lot of nurses are like women of childbearing age who want to be home with their kids more, or you know, you've been a nurse for 30 years and you're tired and you still want to be a nurse, but you want to use your skills at home. There's a lot of different reasons that people want to work from home. So basically I try to help people find these jobs, nurses and nurse practitioners and PAs, but right now I'm kind of focusing on nurses. But yeah, I just try to help people find these jobs. I find them over the internet. I house them on my job board, and then I share them out to all my little social media platforms about almost daily, Monday through Saturday, usually if I'm not tired. So yeah, it's really successful and people are finding a lot of jobs that they wouldn't normally find. So I just wanted to do this to try to give people information, what's out there, how to find it, and yeah, so you can start your search. That was long-winded, I'm sorry. But yeah. Okay, so I will start. I'm going to share my screen. The host has disabled participant screen sharing. 1 second. Okay. We'll wait a minute. Okay. Okay. Let's see. All right. Let's put this on read. Okay, so I made like a little bit of a presentation to kind of follow. If you can't read this or whatever, somebody let me know, but I'm going to continue onward. So basically this is all about how to find and land remote telehealth jobs. It's a little bit of a process. So the agenda is basically right now, the intro. And then we'll move into kind of like all about remote nursing and some FAQ just to get that out of the way. I get a lot of questions all the time on my group. So I kind of know what people are already thinking before I you off all these remote jobs and you're just like, I don't understand how this works. So I'll do that, get that out of the way, and then go over about 12 different job titles that are offered as a remote nursing job online. And then we'll do like a live screen share so I can show you kind of how to search on different job boards and use different keywords and all this stuff. And then I'll do like a little brief thing about how to tweak your resume for these types of jobs and like remote interviewing. That'll be a little bit quicker, but the bulk of it is just going to be teaching you about the remote nursing jobs and how to find them. And then we'll do a Q&A at the end. So let's do it. Okay, so remote nursing jobs are actually pretty widely available, especially now with COVID-19. Obviously, telehealth is like a huge thing, clearly. But a lot of people don't think of nurses as working from home. They kind of think of like, oh, physicians and maybe NPs and PAs. But nurses have a lot of different roles that they can do that aren't, you know, having direct patient visits. It's more of like the peripheral healthcare support. So obviously the perks of working from home are clear. You get a lot better work-life balance. I've found some jobs are still like your 9 to 5 or whatever, but a lot of the time you do get some variety in your day, or you can choose your types of shifts, or just say every day from 3 to 4, I step out, or that's my lunch or whatever. You get a little bit more flexibility to balance your home life and your kids and your work and all that stuff. Pajamas every day, that is true. I have almost never put on a formal outfit in my house. And then bedside burnout, it really goes away. I mean, it's great. There is obviously, it's a job, so you do have stress, and if you don't like your job, then you kind of hate your life just the same as if you're on the bedside. But it does kind of ease that burden of just the constant stress of being at the bedside. Freedom to roam. A lot of these jobs are, I wouldn't say a lot, maybe half of these jobs can be done as you kind of travel and stuff. Some of them do require you to have like hardwired internet, so you need a home office and it needs to be private. So you can't just be like jet setting, but it does give you a little bit more freedom to like be mobile. And then also I legit haven't showered in days. I love adding that one because I haven't. So that's a really good perk about working from home. Showering in the middle of the day is also a perk from working from home. Okay, so the FAQ, I'll just start with that. So what kind of remote nursing jobs are available? There's a lot. I'll go over all of them in like painful detail in a minute, but just right off the bat, like case management, utilization management, telephone triage, data abstraction, clinical review. Those are some of the titles that we'll talk about, and then probably 6 or 7 more of them. There's a bunch of different titles. It's not just one remote nurse job. In fact, that's not even a job. Remote is really the setting in which you do your job, not really like the job title or the job description. So that's a little bit of a misthought. I can't think of the word, but that like you are a remote nurse, and it's really not that. You are looking for like the job title, which we'll go into more too. So how do I find a remote nursing job? It's a little different than what you might be accustomed to as a nurse. Before I was working remote, what I would do is I knew of all the hospitals in my area, so I would just go on their websites. Maybe I would go on Indeed for some weird jobs that weren't affiliated with the hospital, but a lot of people aren't even familiar with how to use like Indeed and even like LinkedIn as a job board. So first and foremost, obviously I have to plug in my website because it's awesome. TheRemoteNurse.com. I find all these different jobs from the internet, and I kind of plug them in with our state licenses, what kind of credentials, and just like your location requirements, because a lot of times that's really confusing on these job postings, which I'll show you in a minute. But since I'm only one human, I can't have everything on there. So then after that, I would definitely do Indeed. LinkedIn is a great place, which I'll show you how to do that a little bit better too. Even Google, you can search in Google remote nurse, and it's going to show up like a Google for jobs thing, I think they call it, and you can sign up for job alerts for that. There's also like ZipRecruiter, Career Builder. There's a bunch actually. So I would start with my website, but then pretty much Indeed is like the biggest one. Most people post their jobs on Indeed, I would say. And then of course, like company websites, if you already know a company you're really interested in, you can go on there. So I have bedside experience, but I've never worked remotely. Can I still get a remote job? Yes. Almost 0 nurses work remotely up front, and lots of nurses are working remotely now. So they expect you, a lot of times they expect you to not really have remote experience. It's more about the job title itself, and you kind of want to get experience in that job title to be able to be qualified for that job title remotely. So it's really less about worrying like, I've never worked remotely, or I don't work at a desk right now. Like, it's really not about that. It's really about the role. Like if you've been a case manager for 10 years, it's going to be so much easier, obviously, for you to just transition that same job at your house versus like completely learning the whole position and also at home alone. So that's just like, don't worry so much about it being remote and the fact that you haven't done remote. It's more about the job itself, the title. With that, I always recommend once you find like a position that you're really interested in, I would try to get experience in a hospital, in a clinic, or anywhere nearby, a physical location, because that's going to just increase your chances of going remote within probably 2 to 3 years. Honestly, like that's the biggest way to kind of get into these jobs. Okay, so can I work remotely so that I can stay home with my children? I want to say no, but I say yes, no, and maybe because it does offer you sometimes a lot more flexibility in your childcare arrangements. So you might have alternative work schedules, or if you're working like a 30-hour job, or maybe you have a spouse or a family member who can watch the child at night and you can take like a night position at home. Sometimes you can offset, the childcare needs like as far as hours, but it definitely isn't a replacement for childcare. I myself thought that that's one of my main reasons for wanting to work remote is to keep my kids home, but I work remote and my kid now has to go to daycare full time because I can't work from home with a child. It's impossible. But yeah, so it isn't a replacement, and a lot of companies actually have things in their contracts that say that you can't be the primary caretaker during working hours because first, you're not allowed, but second, it's impossible, especially for kids that are under 5. You might just want to die, honestly. So, okay, are there any remote positions for LPNs? Yes, there are. They're less available for sure, but they're definitely out there. And usually on my website, if an LPN is allowed in that position, I usually put that right on the title so that everybody knows. But yeah, there are opportunities for LPNs for sure. Just definitely less available. Can I get a remote job as a new grad? Not likely. It's very unlikely. And I think I've seen one posting in the whole time I've been doing this that says outright that new grads are welcome. Usually you need at least 2 to 3 years of experience. The reason, obviously, you don't have enough kind of clinical background and you have kind of less support when you're at home, even though you can contact like coworkers and stuff, you're still it's more independent thought. So you kind of need like a background to go off of to know what you're doing. And then there's just so much competition. So there's a lot of people applying to these jobs. So it's really highly likely that somebody with a lot more experience and qualifications is going to get picked over you. It just makes like sense numerically, like statistically. So you can always try to apply to these jobs, but I would focus more on getting your experience in that job role, honestly, up front. So are there remote opportunities for XYZ state, this state, Missouri, California? Yes, there's remote opportunities for every state. It does get a little confusing because in the job searches, if you're putting your state in there, sometimes it will eliminate a lot of different companies that you could work for because those companies place their location based on maybe their headquarters or where the majority of the people work, when in reality they hire nurses from all over the US or maybe in all the compact states. So if you search by, Georgia, you won't see the company in Florida that's hiring all the compact states. So that's why it's a little tricky. And I'll go into that. I never really specify the location for these jobs, and I'll show you how to do that. But some jobs hire nationwide. Some of them only hire specific individual states, and then some do like compact states. So it really depends on the job. That's why it's the job search. One of the reasons the job search is so confusing, because you don't really know who they're hiring for. They're just like an RN, and then they email you back and say, oh, we're just in this state, and you had no idea. So I'll show you some ways to kind of cut that down a little bit. Are there remote opportunities for XYZ specialty? Yes. I would say there's a lot of different opportunities. So like a NICU nurse could do like NICU case management. That's a thing I see. It's not as common as just like general adult case management, but there are certain things that you could transition to, like oncology. I was an oncology research nurse and I got into data abstraction, which is kind of a big thing right now. A lot of oncology nurses can do that. If you have like primary care or urgent care or emergency department experience, telephone triage might be a good thing. So there's a lot of different ways you can use your experience to kind of niche into a specific remote job. So yeah. OBGYN online birth control prescriptions, that's awesome. That's for obviously NPs, but yeah, there's a lot of different things you can do. Okay, are there any part-time or PRN remote jobs? Yes, they're less common though, and I would say they almost always require you to have experience in that job role, which makes sense. Like, you're not going to hire someone PRN for a job they don't know anything about. It's probably going to be someone who's pretty proficient in what they do, and they can kind
dropped
of be more,
some when I went to put the lid on, and I probably didn't get them all. You just toss them.
Somebody is not on mute. I just want to let you know. But okay, whoever dropped their something is not on mute. Okay, so what is the pay like for remote nursing jobs? This varies widely. It really is dependent on the company, where the company is located, or where you are located. There is no like one way they do it. I've seen some pay a flat rate, and it's maybe 60 grand a year, where in Florida or Georgia, that's pretty fine. That's adequate for like a entry-level remote job, but somewhere in like California, that might not be enough to live on, at least to the degree that you are currently. So It really does depend. And unfortunately, they're not always transparent up front. Sometimes it takes interviewing to figure out that they're giving you peanuts. So that is not fun. But I would say for most of like the Eastern Coast, I would say that the salary ranges are probably 60 to 80K as a full-time employee. And then once you get into like California and that area, those companies that are hiring from California and California nurses or similar scenarios, they will obviously compensate you higher for the cost of living. But I just just know that some of these companies are based out of lower wage states. So, and there's just so many people applying that it doesn't make financial sense for them to hire someone at 120 grand when they can hire someone at 70 grand. So that's something you just kind of have to fine tune once you're looking around. Okay, I've talked a lot. So questions, does anybody have questions about that? We are going to talk about the different types of remote jobs and how to find them. But if you have any questions about the FAQ, go ahead if you need.
I'm interested in a remote job because I want to live in a different country and work. Is that, do you know anyone who has done that? And what are the possibilities of that?
That's a common question too, especially with like military spouses. It's really hard. It's I only know of one company that hires for U.S. nurses who are located overseas, and that's Cortex. I'm just gonna look that up. But and that that role is like you're not really doing full nursing functions, which is why you can do it overseas, I guess. But there's a lot of HIPAA reasons. There's a lot of like licensing reasons, and then there's also just like the companies. That's a liability of the company, and there's a lot of different hoops to jump through. So I really only know of one company, and that's obviously a really big gap that I hope one day kind of resolves. But no, I wouldn't say that there's many jobs that you could get and then pick up and go off to the Germany or or China and just go traveling, unfortunately. But I think in the future things will happen to maybe make that more fluid, maybe.
Sadie, I have a couple questions that I've logged from the chat. If you want me to fire them off to you, and if you don't reply now, just tell me to skip, and then you can come back to it if you're going to talk about it through the content. And again, apologies if I mispronounce your name or any of the nursing language in here. I'm not a nurse, but I'm doing my best. So Adrian asked, are there roles for medical informaticist? Is that the right word?
Informaticist, yeah.
Sure.
That's how I say it, actually. I don't know. Half the stuff I know in my head is what I'm reading, so maybe I'm saying it wrong. Yeah, there are some jobs for that, which I will go into. I have that on one of my slides, but yeah, there are some jobs for that. Some of them are more of like traveling. They might include some aspects of traveling to like help launch like EHR programs and stuff like that. But there are some that are offered remotely. Cool. Yes.
We've also got, is it possible to find per diem remote jobs?
Yeah, they're very much less common and pretty rare, honestly. But there are new ones coming out, like chat-based platforms. There's some new ones that are doing like text to patients type things, and those can be more in and out. Where you're not like committed to 20 hours a week or anything like that. They're definitely less common, but they do exist, and I'm seeing more and more of those as well kind of come up.
Got it. We've got some questions about interviews and kind of lessons learned, and the competition is really fierce. I think you're probably going to go through some of that in a bit, right? Okay, we'll hold those. And then we've got a couple questions on different types of jobs applying to different specialties, like what types of remote jobs would apply to operating room nurses or L&D nurses.
Yeah, those ones are a little bit trickier. There's not as many available for like specifically operating room. I sometimes like medical device companies, I've seen them like want people who have surgical experience. But other than that, there's not some specific role for that, unfortunately, other than maybe like utilization management, some type of surgery, but which I'll go into. But Yeah, that one's tricky. That one is like on my list of things to always look for. But L&D can kind of be coupled into women's health and that whole world. And sometimes there's like case management for that. Again, with NICU, like a NICU case manager, they'll want either like a women's health nurse or a NICU nurse or an early peds nurse, like early age peds. So there's some options for that too, case management and utilization management, and then some of the like triage as well. Yeah.
Got it. There's a lot of questions coming through, so I'll just give you one more and then you can move on. And I think a lot of these trends will get covered during Sadie's content. There are a bunch of questions on licensing, compact license, what's recommended. So
if you're looking for these remote jobs, I definitely recommend getting a compact license. If you're in a compact state, I think there's like 30-ish states that are in the compact agreement. Don't quote me, I don't remember, but I know it's more than half, I think. And if you can just look that up on your Board of Nursing website, or even just Google compact, like I think it's elnlc.com, and you can see if your state's in a compact agreement. And if it is, I would definitely recommend applying for that, because it does open you up to a lot more jobs, especially like the case management jobs, any jobs that you're like interacting with patients and they want to be able to disperse your services to everyone instead of just like people in your state. So definitely do that. If you're not in a compact state license, I don't think you can get in it without living there. I don't believe. I just moved and I wasn't able to get my compact license in this state until I moved here. So don't quote me on that either. But yeah, if you're not in a compact state, you just kind of have to go with what licenses you have and go from there. But definitely the compact license is a good thing to have for these jobs.
And just to kind of speak further to that, we actually provide a lot of resources on our website about licensing in compact states. And so if you go to trustedhealth.com, you can kind of look. I might actually try to drop a few of those licensing links into the chat for you guys to access, because that's typically like a really confusing topic. I understand. For the sake of time, I know you guys have so many questions, and I think it's so great that you're engaging with us and asking these, but we probably do need to move on to the next bit.
And I'll kind of zip through these. I'm aware of the timing. So I will go ahead and just, okay, so I'm going to go into some of the roles. I think we're somehow going to get this document out so you can read it more later. But the first one would be case management. They basically coordinate the care of a set caseload of patients. And that means maybe like inpatient, outpatient, medications, DME supplies, lots of different things. That one obviously is a little bit more patient facing because you are dealing with patients and their issues. And then those ones often offer like full-time positions, and they pay pretty much the best out of all of the jobs, which is usually, I would say 60 to 70 to 80 starting, up to 80, 90, 100 as an established case manager, again, depending on the state. Benefits often offered. You usually need experience in case management, and they definitely like you to be certified in case management, which requires experience. So if you're interested in case management, the best way to get into that type of job is to get that experience in your community, at your hospital. You can contact the case management department and just be like, I would like to shadow someone, like anything to kind of get your feet into that. If you know any case managers, you've talked to them in the hospital, I would definitely reach out and just see, like, don't be like, hey, get me a job, but be like, do you like your job? I'm interested in your job, and just kind of get your foot that way. Because it's the most abundant remote job, but it has the most competition. So I wouldn't expect to, get right in there quickly without some experience. So that's the best way probably to do that. So that's the first one. Utilization management. A lot of times utilization managers will play more of like a financial role or like a business side, where they're kind of comparing services that are requested or rendered against standard guidelines of what's paid for or what's not, and then kind of going through things if there's special circumstances and stuff like that. So it's a little less patient focused and a more, I guess, guidelines and rules focused and kind of the paperwork. Although some of these positions do have to do with patients or facilities and stuff like that, but it is a little bit less patient focused in general. Again, these are mostly full-time. There's some part-time jobs for this, but I see mostly full-time. Same type of pay range, maybe a tiny bit more than case management in some cases. Usually most of these jobs want an RN, and then of course they're going to want a BSN as well, but not always. And then sometimes they also hire LPNs and they just want a nurse. They want somebody who is a nurse. So they don't have any kind of like discrepancy on that. But most of the jobs I would say I see are RNs, these ones included. Get experience in UM if you want to get into it. That's the acronym, Utilization Management. Your quality department, I think, in your hospital. And if you don't really know what area to contact in your hospital, honestly, case management and utilization management communicate a lot together. So just call the case management department and be like, hey, I need the utilization management manager or something. And just, again, try to get your foot in the door and just figure out what options exist. Telephone triage. This one is the most popular right now because of COVID-19. There's a lot of different COVID-19 specific triage positions. You're basically on the phone taking calls from patients to address their symptoms and their needs, and you're following algorithms and guidelines to direct them where they need to go, if they need to stay home, if they need to go to the emergency department or whatever. There's a bunch of different things that you follow for each patient to give them the kind of their end result. And it's entirely patient focused, obviously. And to me, this is like the best side hustle option because a lot of these are part-time nights and weekends type positions that you can do on your days off or after work, although there are some that are full-time as well. The pay is around maybe, it's on the lower end sometimes, depending on the company again, 50, maybe 60, up to 80 possibly if you're like a wizard in it. And then some of them even pay hourly or per chart or per call. I need to change that. But it really depends for these jobs. But I would be careful with these jobs because sometimes they're like, I know one company that hires and offers $4 a call and people are like, that's insane. But it depends how many calls you're making an hour and what they define as a successful call. And so those are all things you kind of need to look into. Yeah. Okay, data abstraction. This is what I do, and it's awesome. But a lot of times for these positions, it's basically you're reading medical records and pulling data based on a bunch of guidelines and information, and you're trying to organize that data into data sets that are able to be used for research or quality monitoring or whatever. So this one to me is the most flexible. This one has no patient interaction. I don't know of a single data abstraction job that talks with patients, but and a lot of these you're able to kind of come in and out and kind of just get your work done by the end of the week, which I know is ideal for most people. 60 to 80 grand a year, similar to the other ones. Some of these jobs don't require you to be an RN, so you might see lower ranges and they just prefer an RN. So be careful with those if money is like your top priority. And then you almost always require experience in data abstraction, and there's specific registries that data abstractors abstract from. And I'm sorry, I keep hitting this mic. So you kind of need experience in that registry. So if you're interested in that, just kind of, I'll do more resources on this eventually, but you can research data abstraction nurse on Google and just kind of look into all the different registries. There's pediatrics, there's actually, I think, a surgical one that might be an option for surgery people, but all kinds of different ones, oncology, all that. Coding's a weird one because a lot of people don't think a nurse can be a coder or should be a coder, but there are options for nurses to do coding or coding-like jobs, like clinical documentation improvement. I think that's, my mind's blanking, but I think that's what it is. And that one is more of like a nurse type role or level. Some of these jobs can pay a bit lower because you don't always need a nurse to be a coder. So again, that's one thing I would look for. They almost all require certification as a certified professional coder or equivalent. Also, if you have done home health, I guess there's OASIS, which is like a credential for coding in home health, I think in hospice maybe, which you could look into. Coding is a little bit, you need to get a credential up front, which costs several $1,000s. And for the pay, it's just something that you have to kind of balance and see. I don't always recommend this straight out, but if you're just like really wanting to work from home and this seems like a good option, then I definitely include it because people do it. Health writing, this is another one you can do. It's not as like widely abundant, but you can work for companies and do like journal articles or even blog articles, stuff like that. Usually you need kind of some experience in health writing if you can do that in any way, or just make up your own sample piece and try to send that out to people if you think. But this is something that is good for like creative people or whatnot. So that's an option. Online education, that's an option. You almost always have to have, well, you do always have to have an MSN, I believe. Maybe for lower level education courses, you could have like an RN, but I haven't seen those much at all, I don't think. I always see that it either requires an MSN and oftentimes it requires a DNP with education experience. So you might want to start looking in your local community college and becoming an instructor there or something to try to get some experience to get into these jobs. They can be full-time, but they can also just be part-time or per course, maybe just taking up a summer course online for online students. Clinical review, this would be like reviewing medical records, and you're kind of, there's a lot of different reasons you might do this. You might make a conclusion about like a patient status or like a quality measure that you're looking at, making sure that services were utilized correctly. There's a lot of different ways you can do this, but this is great for hermits because you're just in a chart the whole time, and that's great. A lot of these require an NP or PA license, but I would say also a lot are like an RN as well. It just depends. Nursing informatics, I touched on this earlier. This is a good option for your, if you have like more of a technological mind and a nursing mind and you kind of want to help improve your systems or your hospitals, like EHR use for nurses and stuff like that. That might be something that you like to do, like being a super user. Some of these are offered remotely. They're not as widely available that I've seen, but they do exist. And they almost always, again, require experience. It's a common thing. I'm just going to go a little bit quicker. Clinical research, you can do this if you've been a clinical research nurse. You can be like a clinical monitor, which this one does involve a little bit more travel because you're traveling to sites that are starting clinical trials or enrolled in them to make sure that they're hitting all their compliance marks. So this one is home-based, but it does involve some travel. So that's an option. And then a legal nurse, there's two more, I believe. Legal nurse consultant, if you're interested in like the legal world or you have experience like that. I mean, I even know some nurses that are attorneys and like, wow, they do this as well. Or, you know, in that world, you can do that. It's mostly like chart review. You're making like kind of medical summaries and just following somebody's, it can be for like personal injury, medical malpractice, workers' comp. That's, yeah. And then the last one, I just always add in nurse entrepreneurship. If you're, sometimes people want to get into remote jobs because they want more freedom and they, you know, stuff. And sometimes that can be a good fit for that. But then if you also have ideas that you kind of want to do yourself and you just want to work from home and you want to be your own business, it's like you're kind of venturing more into nurse entrepreneurship because there is no ideal job that you're employed for someone else where you can work whatever hours you want and do whatever you want. So sometimes I add this in just to be like, hey, do you even want to work for somebody else? Because it sounds like you're kind of wanting the perfect schedule. And really the only way to do that, I think sometimes, is to like work for yourself. So that's it. Also like freelancing, I guess I could put into there too, where you're kind of a contractor and you're just kind of selling your services as needed. Okay, questions. If we want to do questions. I'm going to do a screen share real quick. Fortunately, I can do that pretty quick because I do it every day. So we can get through that quick. And then I'll try to get on to a little bit of resumes and interviewing quickly after that. But yeah, if you have any questions about the actual job titles or roles, we can do that.
I know we had a couple questions about remote jobs with pediatric experience. Do you have any
Yeah, those would fall again into maybe telephone triage. I see triage jobs often want somebody with primary care, pediatrics, hospice, and then obviously like urgent care and emergency department helps with that. But yeah, for pediatrics, I would probably look into telephone triage. There are some triage companies that are specific for pediatrics. And then there's also some case management, less often for sure. And I would say most of those case management positions I've seen veer more on the NICU side, which obviously is still pediatrics, but it's not like the traditional 0 to 18 that you're thinking of, or
Okay,
whatever.
awesome.
21. I don't know what they consider it anymore, but.
I know another nurse asked, with the telephone triage nursing, does it typically just for ER nurses, but because she's seen a lot of like OR nurses that are now been switched to join telephone triage, or do you think it's kind of literally open to all specialties?
It's I would say it's open to most specialties. Those ones that I named are just like the ones that I see most preferred but not required. So any nurse could do any of these jobs really. Yeah, so I would say triage is one of those ones where I would try for it if you haven't. That's probably a good one to try to start at without any kind of remote experience and just wanting to get something. Because again, there's preferred specialties, but not required by any means.
I actually did a little bit of telephone triage on a travel nurse assignment with my pediatric background in a pediatric office. So I think it is out there, for those who are interested. And then I have one other question, and I'm just going to read this one because I'm not super familiar with any of this. Sarah asked, I took a medical billing specialist certification course. CPT and ICD courses included. Would that college certification count as an education or training for nurse coding jobs, or would a more formal certification be required? I also have some experience with OASIS due to working as a home health nurse.
I would say usually they want like that credential, but for the OASIS jobs, a lot of those OASIS coding jobs seems to be for RNs, and I don't think they always require you to be like a certified professional coder. I don't remember specifically, but I think a lot of those are just like they want OASIS experience or a nurse with this type of experience. So those might be a good one to start with if you don't want to get like the full-blown credential. Yeah, but most of the ones that are like a coder specific job will want some legit like certification. But I mean, you can still apply for sure. You have experience, but I would just say, I don't know how successful it would be without the actual credential and a lot of times experience coding behind it, which it sounds like you might have, but yeah.
Okay, perfect. I guess we can probably I think we probably need to move on to the next section.
Yeah. I will. Okay, so I'm going to just do a quick type of job search just to show you how to get started with this. It won't be like wildly exhaustive or anything, but it'll show you kind of where to look and what kind of search terms to use. So I just want to make sure. Can you see my web browser? Yes, I'm going to hope you can.
Yes, I can see it.
Okay, so I just start out with, I'm going to focus mostly on Indeed right now, but I just want to show you my website as well. Indeed is like heavy in the thickness of the forest. It's almost like a wasteland of jobs. It's just so overwhelming. So if you don't know where to start really, and you just want to get some ideas of different job titles to look for and descriptions, I would start with my website at theremotenurse.com. And you can just go here, and the second little thing right here says jobs. And this is basically the job board that I just house all these positions on. And you can look, it's pretty easy. Just pick your specialty certification. If you're an RN, if you're an NP, then you can pick any jobs that are nurse practitioner jobs, and then any jobs that specifically require an FNP or a PMHNP or whatever. You can do that. And then you can also do it by state. The nationwide one I do for jobs that allow any nurses across the nation. It doesn't matter your license. So I always recommend clicking that one up front always. And then if you do have a compact license, click that one, and then whatever individual states you have. And then you'll pull up a listing of all the things that kind of match that. Or you can just go to the newly posted jobs and just start searching through there. So, but these I pull from a variety of sources all over the internet, my email inbox, people messaging me, like all this stuff. So it's a good place to start and maintain your search. But if you want to get a little bit thicker into the depths of the internet, you can go into Indeed. Indeed is a great resource. Most companies post their jobs there if they're posting to a job board. So for this, I will just put in right here, remote nurse. So you can start with that. I always leave the location blank because, again, like I stated, a lot of the companies are based out of a city or state, but they hire nurses in other states or whatnot. So I wouldn't always depend on this. Sometimes you can do a separate search with just your state, and that might show you jobs that only hire in your state for those. So find jobs. Now you pull up like 1,500 jobs. So the problem with just searching something so simple as this is that this is only going to pull up jobs that specifically have the word remote or nurse in it. Actually, remote and nurse in it. So some companies use different words for remote and some companies use different words for nurse. So this is when I recommend definitely going to the advanced search option, going here, and there's a lot of different more complex things that you can search in here. So I want a listing to say nurse somewhere. But in this case, I want it to kind of have a couple different variations of words that they might use. Remote, telehealth, telecommute, telework is one of them, work from home. And then also if you have like a multi-word phrase, you can do that in quotes and that'll see it as one word together. Otherwise, if you do work from home without quotes, it's going to look for jobs that have work and from and home in there, which will give you a lot of garbage, honestly. So with none of these words, you can eliminate some words. So oftentimes I'll eliminate the word driver, drive, car, travel, if that's not something you want, because a lot of like home health jobs can be home-based, but you're traveling around the whole county. So you can just play around with that and see kind of what pops up. There's a lot of different things you can edit for. And then again, I always leave the location blank. I'm searching for jobs for everyone. So if you specifically have, more fine-tuned searches, you could certainly put some locations in there. I would just do the state though. I wouldn't do like your city. So you can see this opened up to 2,500 jobs just by changing some of the words. And in here, you can even do like nurse or RN, because maybe somebody just writes RN, nowhere in the listing they write nurse. So find jobs, and then you can see now 3,500 came up. So, and then you can also list it by date. So you can kind of see what's new. And I always recommend doing this because these jobs are so highly in demand that you really want to get your applications in there as quickly as you can before the HR people are tired of looking at like thousands of applicants. They're excited to get applicants. They're waiting for it. So try to get in there as soon as you can, which is why I also recommend doing job alerts. So right here, you can see this is my whole search I just did. If you find one that works better or worse or whatever, and you just hit like a sweet spot of a good search, you can set up the job alert, activate it, and it'll come, I think daily for Indeed, it'll show you new listings. So not every time you're looking for a job, you're going to find 3,500 new jobs. It's going to be like a constant maintenance of maybe 10, 20 jobs at daily. So yeah, that's Indeed. That's the biggest place to probably look. I also use LinkedIn. If you don't have LinkedIn, I definitely recommend getting it. It's basically a living resume and you can network with people you've never even heard of. So it's great. So they have also a job section, and you can do the same type of searches here. Just quickly, I'll show you one of these. When you go on one of these job listings, you can see how many applicants have applied. You can see who posted it. She's a talent acquisition specialist. Awesome. Like, send her a message. That's actually a paid premium feature, but you can also look at your connections and see if you know anybody who works there that can get you kind of a referral or whatever. And then it'll give you actually, well, this is also a premium membership thing, but you can say like what your LinkedIn profile looks like in comparison to the other people who have applied. So I've even used that before for my own stuff. And that's really helpful to know, like, okay, right now I'm 10%, top 10% for this position. I should apply. Or if I'm like not, it's just like, okay, what am I doing? Don't even do that. So you can find all kinds of stuff there, company info, and then go look at the companies, follow the companies like a social media platform, go to see who the employees are. Oh, look, there's a HR person. Let me connect with her, you know, so it's a really good place for that. So that's the job search. I wanted to make that a little fast. So hopefully you can get you started at least using these. Okay, we can do questions real quick. I can actually do the resume and interviewing thing probably in 3 minutes. So I can just start there if you want. And then we can do questions, if that's good. I'll go ahead and do that. Okay, so resumes are really important for these jobs because there's a lot of people applying, and you need to make sure that your resume is appropriate for, sorry, I'm gonna get this video out of the way. Appropriate for the applicant tracking system, which is like an automated filtration system that will use the company and the job postings direct keywords to kind of filter in or out resumes. A lot of the larger companies do this. So you just need to make sure that when you're doing your resume, kind of try to double check with the job listing that you're applying to make sure that you're using cohesive words. One example I use is like if you're an informatics person and they're using the word EMR and you're using the word EHR, or you've just spelled out electronic health record, it won't match because it's like that's not the keyword they're using, even though you're fully qualified. So I would say just tweak your resume a little bit based on those major keywords. Or if you see listings that have this one keyword in it all the time and that's the job you want and that's what you have, add it to your resume. There's also some like websites that will kind of scan your resume for stuff like that. Spell things out and use the acronym. So if you're a certified case manager, write that full thing out and then do CCM in parentheses so that you just make sure that the system sees both of those in case it only picks one and not the one you want. Yeah, that's the big thing with these ones. Apply ASAP. That's, again, I just said that. Apply ASAP. There's so many applications that it's just sometimes it's like they're not going to look past number 200. So get in there before number 200 comes up. And then interviewing remotely, it's really not that complicated. It's just like being on a Zoom chat. Yeah, just do the same things you do. Just make sure kind of like your lighting is okay. Like I have a light source coming right here. I wouldn't want like a light source back here because then you become a silhouette and nobody can see your face. And then just make sure there's no like trash over here or food over here or weird stuff or like inappropriate posters or anything like that. That's just stuff to look for. Your audio and video, you can always test beforehand. Usually they're going to send you a link to the meeting and you can just click that link and go in there and kind of test your audio and visual but like maybe 10-15 minutes before the conference starts and just make sure everything's right. So yeah, but other than that, also I always recommend actually wearing like an interview outfit, even your pants, because to me, it's a vibe that you're in. If right now I'm in a pullover sweater and leggings and I don't have shoes on, and I don't think I would be like as professional as I could be if I was just wearing like my blazer and my work pants, maybe not shoes, but it is a vibe and you can kind of tell when people are just kind of lazy and haven't done their hair. And it's just like, okay, you don't have to be a video versus an in-person to know that like you haven't prepared for this. And then the last thing I'll say for that interviewing is I would always pull up 3 things on your desktop when you are interviewing. The job description that you applied for. You should probably know what you were applied for and you're interviewing for. Your resume, so you can reference like dates and certain things like that that you might not know off the top of your head. And then also their company website, I would have that available just so you can quickly look at stuff. And beforehand, you should kind of research them and look at their mission statement and like things that are happening, their news and stuff like that. Those 3 things you can have up on your desktop, or you can print out as well. So that's it. Okay. I think we have 5 minutes left. So if you need any information more, you can just go on my website, theremotenurse.com. I have it fields out to all my different social medias and stuff like that. And then our Facebook groups are really big, remote nursing jobs, and then remote NP and PA jobs. And then I'm also on Instagram, Facebook, LinkedIn as the remote nurse. So now we can do Q&A if anybody has any more questions.
I think I saw a few come through.
Okay.
And one, which I think is interesting, so I was going to ask you, if you live in an RV, do you just need, and you move around the country, do you need state licensure just for the headquarters, like where the company is based, or where you claim as your tax residence?
Yeah, that one's complicated. I get this question a lot because a lot of my group is like RV travel nurses, which is awesome. But it does make it difficult. It depends what job you're hired for. If they just want you to have an Arizona license and they don't really care what else you got going on in your life, then you're working like in an Arizona license aspect, and that's fine. Or a compact license, that's always great. But yeah, it really depends on what you're hired for. And I would say a lot of times it's mostly dependent on like the patients you're serving and what license is required from that. Yeah. So the one thing with RV nurses that they get a problem with is that a lot of these companies require you to have like hardwired internet or and stuff like that, which is obviously impossible in an RV. So that is something I see RV travel nurses struggle with sometimes. But other companies, you can kind of get away with like satellite or cellular internet, especially like chart review and stuff like that. You do have to worry about like HIPAA and stuff with Wi-Fi and all that, but yeah.
Okay, I have another one that I found that I think is super interesting as well. So the remote jobs that are posted continuously on Indeed, would you recommend applying to those, or is that a red flag?
Like as in they're being posted over and over and over?
Maybe is that a red flag to work for that company?
I mean, I don't know. I would maybe think of it as high turnover to me, or high growth, maybe. To me, if I see, and there are some companies where I see like a posting going up every month, it's a little weird to me, but then also some companies just hire monthly, and I don't know, but sometimes I would maybe dig a little deeper. I would maybe go on glassdoor.com and look at their employee reviews and see like what's going on. I think you can even search for like keyword nurse or something in there. Even my Facebook group has a lot of the remote nursing jobs has a lot of different reviews on different companies and insights. So you can kind of get some idea that way. But I would say in general, it would be pause for me to kind of start Googling a little bit, but that doesn't count for like major insurance companies like Aetna and stuff. They're so huge that of course they're posting multiple positions every day because they're just all over the country. It's not that they're posting the same position over and over. They're just posting one of their million positions. Like, so don't let that part confuse you, but the same specific position over and over is a little bit of a red flag, I would say.
That's good to know. I've seen a few questions related to, do you think COVID, well, I guess we can kind of wrap this into one question. Do you think COVID is making it more competitive to get these jobs? Or do you think the current economy in general, just like, how hard is it to get these jobs right now with the state of things?
Yeah. Well, I'll give you a reference because my group has been around for a year, and before COVID, it was extremely hard to get these jobs. Some people were applying for months and years, very hard to get these jobs. And now it's very hard to get these jobs because first of all, a lot of nurses are burned out and they want to get away from the bedside, which is totally understandable. And then some nurses are out of work, so they need something from home. And for a while, everybody's kids are home, so they're like, I can't actually go somewhere. So yeah, I would say the competition right now is heavy, and I think it's going to get heavier and heavier and heavier. So that's why I think it's best to really focus on maybe 2 or 3 types of job roles you want and really start getting experience in those roles so that you're not fighting against the masses of people who just want to work remotely and they don't even care what they're applying to. Really try to get yourself some qualifications and make them want you rather than like being a desperate hand in the crowd, which most of us are with these jobs, honestly.
Yeah. Well, guys, it looks like it's I live on Eastern Standard Time, but it's 4:01 right now, so we've kind of reached the end of our hour. But Sadie, thank you so much. You did such a great job, and that was super informative. As a nurse who works remotely myself, I think that was really helpful, and I think you touched on a lot of topics that a lot of nurses want to know right now.
Yeah.
And just to go back to kind of speaking about working remotely as a nurse, Trusted Health is a company of nurses for nurses. And so most of the nurses at our company are in different roles, and we all work remotely and we love it. So I encourage you to try it out. I do marketing, which is, doesn't always, people are pretty surprised when they hear that with my background. But we have nurses do coding, our nurse advocates, which are support roles. So there's a lot of opportunities out there. We will be sending the recording and a little bit more information following this. So thank you guys for coming. Happy Nurses Week, and enjoy the rest of your weekend.
Yeah. Thanks, everyone.
Well, thanks, Sadie. Thanks, everyone.
Yeah.
Bye, guys. Y'all take care.
Thank you.